Hi everyone, our paper title is ARM, a real-time health monitoring mobile application. The presentation will be divided into 5 parts: introduction, aims and objectives, the proposed approach, testing, as well as conclusion and future work. Recent advances and innovations in accessibility and usability of mobile devices and wearables form a new lifestyle. Users stay connected and access to a wide range of information, applications, and services as required. Healthcare is one of the key fields that benefits from mobile and digital technologies. Compared to inpatient treatment, which are usually resource-consuming, mobile health applications offer a number of benefits such as reducing healthcare costs and enhancing convenience for healthcare stakeholders. There are a number of m-health applications in the market. Following are some examples. First, Lab will propose a healthcare mobile application that measures user physical data by using wearable sensors to monitor health fitness. In addition, this system alarms users via text or email in the case of health risk. However, it provides users no communication, feedback, or interaction to approach healthcare teams. Second, Clean Touch is designed for mental issues and disease. This is implemented and evaluated as a pilot to provide symptom tracker, diary function, and appointment reminder service. However, it matches no National Health Service principle due to the lack of solid safety and security. Third, Sismo presents a smartphone application through which blood pressure is collected and monitored. For this, smartphone accelerometer and camera report the heart vibration and pulse from the user's fingerprint. By this, the user is able to monitor blood pressure if any treatment is required. Some of the mobile applications are dedicatedly designed for specific disease. It can be observed that none of them combines online treatment and real-time body data monitoring well for general disease. There are 2 main drawbacks for traditional inpatient treatment. Firstly, the hassles of getting an appointment and long waiting time in hospital are unbearable, especially when the healthcare services are restricted or patients are under pain such as stomachache. Secondly, inpatient treatment needs physical contact, which increases the risk of being infected with epidemic, especially during the pandemic of COVID-19. Our application, ARM, a real-time health monitoring mobile application, is a promising approach to make it possible for patients to receive good treatment for general disease at home. The application aims to combine the key healthcare features to propose a mobile application which is able to collect body data with minimal physical contact, manage healthcare records and treatment plans, as well as provide real-time communication with doctors. With the help of ARM, healthcare teams can remotely monitor patients and provide them required treatment instructions with minimal physical contact. Now let's move to the proposed approach. ARM achieves its purpose through several functional parts. There are questionnaires, tracking environment, and sensoring design. First, the questionnaires are designed to collect health self-reports from patients. For this, questions are designed according to their user health issues and their data requirements. For example, a patient who suffers from stomachache should be provided a questionnaire which asks for stomach symptoms. For this, doctors, specialists, and healthcare teams will design the required question from a checklist to collect the required information from the patients. Second, chatting module is used to make a real-time communication between the healthcare team and patients. It allows both user sides to share additional required data and discuss about the treatment plan. It allows patients to report their uncommon symptoms or disease signs which are not covered by the provided questionnaire. Third, sensory design is used to collect physical data. It allows doctors to remotely collect patient body data with no physical interaction. It allows doctors to use accurate and real-time data to investigate the health issue and plan the required treatment. Figure 1 shows the design of sensory module. The system can be divided into 3 parts: sensors, core application, and a database. Interactions between them are shown in Figure 2. To evaluate AIM's performance, comprehensive testing is conducted. There are respectively functional, system, front-end, back-end, and hardware testing. Functional testing aims to check whether AIM is able to perform the designed operations or not. The following table records the response for each particular test scenario. It can be concluded that AIM is able to manage the user transactions in general. It should be noted that these tests were carried out by non-professional users by yet. It can be adjusted as future work to test this app by professional users such as healthcare teams. System testing focuses on system recovery, which aims to check how AIM is able to recover in the case of any crash or hardware failure. For this, a hardware crash is simulated through a shutdown mechanism, using which AIM server is suddenly restarted and the database is rebuilt. It evaluates AIM performance and the database recovery in the case of a server crash. A registration operation is used to test the system's functionality. By this, the database should be able to successfully retrieve the registration information if the system is restarted after a sudden shutdown. To evaluate system scalability, AIM functionality is tested when multiple users simultaneously log in. For this, a test scenario is designed through which 60 test users try to work with AIM at the same time for 10 minutes as a simple checkup. During the testing period, no obvious delay or system failure was detected and all operations went on smoothly. Front-end testing focuses on evaluating the graphical user interface, functionality, and application usability. For example, all design buttons were tested to work, and the pages were tested to be correctly interconnected. It supports that AIM user interface is fully implemented and correctly works. Back-end testing examines whether the system is able to correctly respond to the user request or not. This is conducted as follows. One test users, Android phone AIM, the corresponding sensors, and the database server. By this, the user submits a number of new transactions to modify database records. The objective is to study how the AIM database deals with the new transactions according to the system requirements. The following table summarizes back-end results for each operation, which is designed according to the testing scenario. It shows that AIM is able to manage data records and correctly forward and reply database transactions and queries. Hardware testing evaluates system functionality, sensory device stability, system and sensor compatibility, and measuring error rate. For system functionality, If user frequently moves their fingers or wrongly use the sensor, data collection fails or returns inaccurate results. For sensory device stability, the first thing is that particular factors such as weather and skin sweat may address wrong results. The second issue is that users may lose their patience since data collection requires to have 10-second finger touch to collect multiple sensory data. For system and sensor compatibility, ARM Bluetooth connection may fail if any other application is used during the Bluetooth connection. Besides, ARM can't read sensory data if Bluetooth is not successfully interconnected. For measurement error rate, the accuracy of the measurement is about 92%. Hardware testing shows that the accuracy and the reliability of collected data is highly dependent on the hardware factors. In conclusion, ARM provides online health monitoring that offers a number of benefits to enhance the quality of healthcare service. It aims to keep patients and healthcare teams interconnected, as well as collect and analyze physiological data in real time. ARM's remote and real-time body data collection result in reduction of healthcare costs and risk, especially during COVID-19 pandemic. ARM achieves its purpose through three functional parts. The first part is healthcare questionnaire, which allows patients to report their physical information and can be accessed by doctors. Wearable sensors connect to ARM by Bluetooth enable various body data be collected and transmitted to healthcare teams. If patient profile is updated, ARM will forward corresponding health records to healthcare team for further monitoring and treatment planning. Finally, it provides a chat channel through which doctors and patients would be able to communicate in real time. Two main contributions of ARM can be concluded as follows. Firstly, it makes patients and healthcare teams far apart to be interconnected. ARM allows healthcare teams to manage healthcare service and inform the patients online. It allows the user to create it and update their profiles. Patient profiles are linked to the healthcare records, which can be accessed by the doctors during treatment procedures, whereas doctor profile provides their updated experience, availabilities, and specialists. Moreover, ARM has the potential to include a variety of diseases, which enables it to be utilized for various healthcare scenarios. Secondly, it monitors and shares physiological data in real time. ARM allows patients to obtain real-time data through connected sensors, and it provides real-time links for healthcare stakeholders to communicate through. In summary, ARM guarantees the efficiency and accuracy of treatment at the same time. It results in the reduction of healthcare monitoring costs and the risks, especially during COVID-19 pandemic. There are three issues that can be addressed as future work. Firstly, currently the chat environment only supports text communication. Audio and video communication can be added. Secondly, a chatbot which enables automatic question recognition from user text can be developed. Third, it is required to consult with COVID-19 specialists to redesign the questionnaire dedicated for COVID-19. That's the end of the presentation. Thank you for watching.